Again, when I hear the word addiction, I always thought people like...
a junkie.
Yeah.
Shaquille O'Neal appeared on Dax Shepard's podcast, and I want to just break down what my observation and my opinions are about whether or not he showed signs of addiction. Thank you for joining me on the Dr. Suzette Glasner podcast. Don't forget to hit like and subscribe to my channel if you want to continue to learn from me. If you have any questions or comments, you leave them in the chat. And if you're not comfortable leaving them in the chat, then feel free to email me at askdrglasner@gmail.com. So today we're going to talk about some of the subtle ways that addictive behaviors can emerge. And the reason that I want to talk about this is because recently Shaquille O'Neal appeared on Dax Shepard's podcast, and they got into a conversation about his prior history of opioid painkiller addiction. And as they talked about it, Shaq was a little uncertain in regards to his use of painkillers.
But have you ever been scared about any of that?
Addiction-wise.
So I have a question.
Yeah.
Is addicting for the chemical effect, or you just taking it? Because I was having a heated discussion with my doctor. He's like, you were addicted, but I didn't feel high.
You just felt the absence of pain.
Yes. So I didn't know that was addiction.
Was it addiction? Was it not? Was he really needing to use these pills in order to function and perform in a high stress position, carrying the team, and just a lot of demand and pressure on him? And would anybody have used them in his situation in the way that he did? And I want to just break down what my observation and my opinions are about whether or not he showed signs of addiction.
But let's get deeper, Shaq. So there's the absence of physical pain, and then there's the absence of the mental anguish. So even if you're not feeling high, but you're suffering mentally, and that thing provides relief.
I don't think I was suffering mentally. If I had a knack, I would take it. I don't want to feel that knack because we need this game.
I'll do the spoiler, which is that, yes, I think that Shaq was addicted to his opioid pain pills, but I would have to talk to him a little bit more about some of these signs and symptoms that he experienced to know for sure. But my first impression was that, yes, we have a lot to learn from Shaq's description of what he was experiencing and what he was going through, because I think it's a very common kind of experience that people have where they're really on the fence as far as understanding whether what they're experiencing is problematic or something they should be worried about or not.
Yeah.
Yeah, it was
Well,
more
you said I
physical.
could play good without them.
Yes, but I need to play great.
This is a little complicated because I don't know all of the nature and extent of his physical conditions, and maybe he really did need them to play as well as he did. But one of the fuzzy lines there is that there's a physiological need that you can have for a substance that has some negative potential effects like addiction, and then there's the psychological piece of it that can be equally, if not more powerful. What leans me towards thinking that this was a sign of an addiction is that this persisted over 19 years, and typically people are not on painkillers for that long. Again, also the typical person isn't a star on a basketball team the way that Shaq was, but still the length of persistence of him needing to take those pills in order to function really begs the question of how much of that was psychological, how much of it was him worried about what would happen if he didn't take those pills. And that's what happens with addiction to other substances. You start to develop this sort of physical dependency, but also a psychological dependency where you think, okay, you can't cope with stress without drinking. You can't cope with pain without painkillers. You can't cope with insomnia without smoking weed. When in reality, we are a lot more capable of overcoming discomfort and performing at a high level without many of these substances on board. My take on it is that there was some part physical for Shaq around the need to manage the pain with some kind of medication. And then there was another part that may have been larger that was psychological.
And then I always do homeboy math. Always says take one, I'm taking three.
Now that is a telltale sign of addictive behavior because there's two things happening potentially. Either he wanted more and more of that feeling of relief that the pain pill was bringing about, or again, the psychological component, he was worried about not performing at a high enough level. So he just increased the dosage to be absolutely sure. And that's part of that whole psychological dependency and that feeling that he needs to make sure that he's extra covered by this medication in order to perform well. There's also a physiological piece of this, which is that one of the signs of an emerging substance use disorder or addiction is when a person needs to take more and more of a substance in order to feel the same way it used to make them feel at the beginning. That's the body developing tolerance to a substance. That is one of the symptoms that counts towards a diagnosis of a substance use disorder. And a severe form of a substance use disorder is known as addiction. So he definitely had that symptom. If he could take 3 and he didn't feel much different on 3 versus 1, then he certainly had developed tolerance.
And you weren't increasing the amount. That's a big thing.
Well, I was.
Yeah.
Oh, you were continuing to.
Yeah, it says take 1, I would take 2.
But then would you take 4 and then 8 and then 16, like that type of thing?
Important games, yes. But I didn't feel high.
So that also made him think, I'm probably not addicted to this stuff. The reason that's wrong is because, again, it's a sign of developing tolerance. Your body has adapted to the presence of a substance, so much so that the same amount that used to produce a brain chemical response is not producing that same response. The brain is sort of habituated to that. And so when you take more of it, you're not really feeling anything. That's tolerance, and that is a symptom of addiction. So while he was interpreting it as maybe I wasn't addicted because I didn't feel high, and so I wasn't seeking out a high per se, he was developing a physiological dependency, and that's evident from him not feeling so much of a difference when he's taking 3 versus 1. For most of us, if we are what's called opioid naive and we've never taken an opioid before, if we take 3 opioid pills, we're not going to even feel like we could talk, some of us. We'd be so sedated, wouldn't probably feel very good. Yes, he's a bigger guy. The fact that he could go from 1 to 3 is telling in terms of his body having developed tolerance. And the final sign that I'm going to talk about that he mentioned was, while he said his addiction was not necessarily a secret because his trainers knew about it, he then said that it was a secret from certain people.
You never hide, right?
The trainers knew.
Okay.
Yeah, I mean, I'm not telling my wife or my kids or my boys, but like, hey man, got this knee pain. Here you go.
Yeah.
Take 1.
Yeah.
Now, there are different reasons that people who are prone towards addiction might end up harboring a secret about a substance that they're using. One of them could be the brain is becoming hooked and dependent on a substance, and anything or anyone that's going to stand in the way of feeding that addiction is something or someone that your brain is going to tell you to intuitively avoid. So if his wife would have stopped him from taking those painkillers or not accepted it, if his kids would have expressed concern about it and led him to feel conflicted about it, and he was on a path to addiction or he was already addicted to them, then of course he wouldn't want to talk to them about it because his addicted brain is intuitively telling him, stay away from those people because you're not going to be able to take more of me. So that's part of the development, but it's very subtle, right? You might experience this where you're just intuitively keeping things that you're doing a little bit more than you meant to or planned to from certain people, and you're not really thinking about what that means. But if you stop and think about it, that probably means that you're headed towards, if not already in, a problem relationship with that substance. The other reason that he might not have been mentioning it to them is something very common for people who are experiencing addiction, which is tied to shame. When someone feels like they're starting to lose control over the use of a substance that they've been taking, that brings about a lot of feelings of shame. And our intuition when we feel ashamed is to close up and get a little bit walled off from people who might want to hear or talk about it because of fear of the way that they might react. So if I had to guess, I would say one of those processes was going on with Shaq. Either he was dependent enough on these opioid painkillers that his brain was in a state where it was telling him, don't share this with anybody who will cut us off because we need to keep taking this for you to perform, whether that was actually true or not. And then the other part was that since he was doing homeboy math and he was taking more than he was prescribed, it was a little bit out of his control and he didn't like that. So that made it harder to talk about with people. Now, I'm not saying he was aware of any of this going on because this is like a big unpacking and breaking down of what psychological process he may or may not have been aware of. But that's what some of those type of statements he made really signaled to me as an addiction expert. I hope that you found this useful. If you or somebody you love are experiencing any of those things, increasing the amount of a substance that you're taking, feeling like it's not really affecting you when you do, and or hiding your substance use from someone who cares about you or who you care about or you love, give it an extra thought. What does that mean about me and what I might need to do in order to preserve my health? I would encourage you, even if it feels a little scary, to go out of your comfort zone and talk to somebody who you think will be there for you, who's very supportive of you, to do a little bit of a reality check. I hope you learned something valuable, and I will see you next time.